All right, Dr. Lebo, Gyno. So we have post update number 2. This gentleman from Texas who had surgery done, a couple years ago from a gynecomastia surgeon here in New York, and just didn't do a good job. Left a bunch of gland in, especially on the left side. Actually didn't even take out the gland, just did lipo without gland removal, which is so wrong, so wrong. And he does tout himself as one of the best gynecomastia surgeons. But that said, the results were not great. And what I've done with gynecomastia and taken it to the next level, where on people who need lipo, people just need gland removal, we do it, and I'm so great at this. Local anesthesia, get it all out, and I contour the chest with the gland removal and a little bit of fat to contour it great. But in this gentleman, being in his 50s and he was heavier. He was like 230 pounds when we first talked, and now was under 200 pounds. So we went beyond, Lipo, Gyno and beyond. So we did Vaser, high definition, power assisted liposculpture, gland removal that was left from the previous surgery, and we did from neck to nuts, and we turned them 360, did the upper, mid, and lower back. Stealth incisions in the armpit, nipple, belly button, and inside the groin, and also in the back, the mid, and the lower back. In the intergluteal crease. He did not want any lipofilling, though I suggested it, but he said, no, we can always do it because there's some fat that we can harvest if he really wants it later on. I hope for him to even get into better shape, lose a little bit of weight, build a little bit of muscle, build a lot of muscle, and we're going to follow him great. As far as bruising goes, I mean, this is not that bad. We got out almost 6 liters of fat from him, took out the gland, and now what's happening is that Peter is doing, Body by Peter, he's doing lymphatic massage, and he's going to stay for a couple days. So he's going to have this every day until he leaves, which will either be Friday or Saturday, depending upon how he feels. I did not give him the deep six-pack because with his body, that would look like a Ninja Turtle. We did not want that, but I wanted it natural. So I did give him a hint of a six-pack with some lines and shadows, which will define itself as the swelling goes down, as he loses weight and builds muscle. And I want only the best for my patients. We did Renuvion, no lipofilling. He did not want that, as I mentioned. And we did Renuvion J Plasma, of course, to tighten everything up. This is some bruising, which is absolutely normal, especially to the extent that I did the aggressive lipo on him to snatch his waist and contour his body to absolute perfection. So anyway, all that said, he looks great for only being the second day post-op. He is on a water pill to get the fluid out of him. He's going to walk around, and I'll see him every day until he leaves. And that's it. Dr. Lebo, Gyno, and beyond. Let's go.